Leg cramps. The kind that hit you at 2 in the morning. The kind that sees your calf so hard you can't move. And that glass of water on your nightstand. The one you've been faithfully filling every single night, with that little electrolyte tablet dissolving beside it, may have nothing to do with the real reason it keeps happening. You've done what you were told. You drank your water. You stayed on top of it. And yet, there it is again. 3 in the morning. The same leg. The same pain. The same question you never get a straight answer to. So here's what nobody explained. The reason that glass of water doesn't stop the cramp isn't because you aren't drinking enough. It's because after 60, the rules changed. And no one updated you. For decades, seniors have been told that nighttime leg cramps mean one thing. You're dehydrated. Drink more water. Stay ahead of it. It sounds right. It feels responsible. However, a 2012 clinical review published in American Family Physician found that nocturnal leg cramps have not been reliably linked to dehydration or to disturbances in electrolytes like potassium, sodium, or magnesium measured in standard blood tests. The mechanism is more complex than anyone told you. The real trigger often isn't low water. It's what's happening inside the muscle, at the nerve level, when the mineral environment around that muscle is off. That one word, dehydration, has done more damage than you think, because it made the whole thing sound simple, and simple made you stop looking. My name is Dr. David Collin, and I need you to hear something clearly before we go any further. This is for educational purposes only. Always discuss changes with your own doctor. What I'm about to walk you through is not a prescription. It's a conversation. The kind I wish someone had with every senior I've ever talked to, before they spend another year blaming water for a problem water alone cannot fix. The real enemy here is not bad intentions. Your doctor isn't hiding anything. The problem is outdated hydration advice, guidelines that treat night leg cramps like a faucet problem. Turn on more water. Done. But after 60, your body doesn't work that way anymore. Your thirst changes. Your kidneys change. Your medications change what your body holds onto and what it flushes out. And the advice never caught up. After 60, everything changes, and most people aren't told why. By the time I'm done, you'll understand exactly why 2 seniors can drink the same amount of water after dinner, and one of them still wakes up with a locked calf at 2 in the morning. And once you see it, you'll never think about hydration the same way again. Let's start with what's actually happening inside your body after 60. Because this is where the story begins, and it's not where you think. Your body at 30 held roughly 60% water. By the time you're in your late 60s, that number has dropped. A 2023 review published in the journal Nutrients confirmed that total body water declines with age, sometimes to as low as 50%. That means you're starting every single day with less water on board than you had 20 years ago. Less margin, less cushion, less room for error. Now here's where it gets quiet and dangerous. Your thirst, the signal that's supposed to tell you when to drink, starts fading. A study from the journal Medicine and Science in Sports, cited by the National Institute on Aging, showed that older adults exhibit decreased thirst sensation and reduced fluid intake even after being deprived of water for 24 hours. Young people in the same study got thirsty fast. Older adults? Some of them barely noticed. Think about what that means. Your body needs water. Your brain doesn't send the message. You feel fine. You go to bed. And your muscles, specifically your calves and your feet, are quietly running on empty. But here's the thing most people miss. It's not just about the water. It's about what's dissolved in that water. And this is where the real story starts to separate from the one you've been told. If water were the whole answer, why are you still waking up at night? Your muscles don't run on water alone. They run on a system. Think of it like a car battery. The battery needs fluid, yes, but the fluid has to carry the right charge. Sodium, potassium, magnesium, calcium. These are the minerals, the electrolytes, that allow a muscle to fire and then release. When they're in balance, the muscle contracts, does its job, and relaxes. When they're not, the muscle contracts and stays contracted. That's a cramp. That's what's happening at 3 in the morning. Magnesium is the one I want you to pay attention to. The NIH Office of Dietary Supplements, updated January 2026, states that magnesium is a cofactor in more than 300 enzyme systems in the body. It plays a direct role in muscle contraction and nerve impulse conduction. And here's the part that matters for you. Older adults have lower dietary intakes of magnesium than younger adults. Magnesium absorption from the gut decreases with age. And renal magnesium excretion, the amount your kidneys flush out, increases. Less coming in. We're going out. Every single day. Now add potassium to that picture. Potassium works alongside magnesium to keep the electrical signaling in your muscle stable. When potassium drops, the nerve-muscle connection becomes excitable, twitchy, unstable, and at night, when your body is still, when blood flow to the legs naturally slows, that instability has room to fire. And sodium, which most seniors are told to avoid, actually plays a role in holding fluid inside the cells where it's needed. Without enough sodium, water passes through you. You drink it. You excrete it. The muscle never gets what it needs. So picture it. You're drinking your water every evening. Good. But your thirst signal is already unreliable, so you may not be drinking enough. The water you do drink is plain. No electrolytes. No mineral balance. Your kidneys are flushing magnesium faster than they used to. And if you're on a blood pressure medication, especially a diuretic, you may be losing potassium and magnesium through your urine at a rate you have no idea about. Diuretics. This is the part one need you to hear. A 2021 review in the Journal of the American Heart Association confirmed that loop diuretics and thiazide diuretics, two of the most commonly prescribed blood pressure medications in older adults, can increase the loss of magnesium and potassium through urine. The NIH's own magnesium fact sheet names chronic treatment with loop diuretics like furosemide and thiazide diuretics like hydrochlorothiazide as direct causes of magnesium depletion. You're taking the medicine your doctor told you to take, and that medicine is quietly pulling minerals out of your muscles. And then you wonder why the leg cramps keep coming back. Most seniors never connect this to that. Today you will. But it's not just diuretics. Proton pump inhibitors, the acid reflux medications like omeprazole or lansoprazole, can cause low magnesium when taken for more than a year. The FDA issued an advisory on it. Laxatives that contain magnesium can actually disrupt your magnesium balance if used regularly, because the laxative effect pushes the mineral out before your body can absorb it. And if you're taking any of these medications together, which many seniors are, the mineral drain compounds. This is the part most seniors never connect. You're not doing anything wrong. You're drinking water. You're taking your pills. You're following the plan. But the plan was never built for what's happening inside your body after 60. The advice came from a time when hydration meant water and cramps meant drink more of it. That advice is not wrong. It's incomplete. And the gap between incomplete and complete is the gap where your cramps live. So now you know why this starts. But knowing where it starts is only part of the story. Where it leads, that's what nobody showed you. Because here's what happens when this goes unaddressed. Night after night, the cramp returns. You lose sleep. Broken sleep leads to fatigue. Fatigue changes how you walk the next day. You're slower. You're more cautious. You start avoiding the stairs. You stop walking after dinner. And slowly, so slowly you barely notice, your world gets smaller. And it's not because you're old. It's because a mineral imbalance in your calf, one that could be identified, one that could be addressed, was never explained to you clearly enough to act on. This is not age. This is something your body is doing, and we can fix it. Now the story gets more specific, because I've told you that plain water alone often isn't enough. I've shown you why the minerals matter. But there's a layer underneath all of this that makes the problem worse. And it has to do with timing. Most seniors who are worried about leg cramps do something very logical. They drink a tall glass of water right before bed. It feels responsible. It feels protective, like they're putting fuel in the tank for the night ahead. But here's what actually happens. That large volume of plain water hits your system late. Your kidneys respond by increasing urine output. You get up at midnight, maybe twice. The sleep you needed to recover from yesterday's fatigue, gone. And the water you drank? A good portion of it left through your bladder before it ever reached your muscle tissue in a form your cells could use. You traded cramp relief for bathroom trips. And the cramp still came. Because the water had no mineral payload. It was volume without function. And the timing made it worse. I want you to drop a letter in the comments right now. If you still reach for plain water first when night leg cramps hit, drop the letter A. If you believe the smarter move after 60 is to think about electrolyte balance, timing, and the medicines you take, not just water, drop the letter B. I read every single comment personally. Let me know below. And now here's the part I've been building toward. Everything I just told you is real, and it matters. But there's something that changes all of it, something almost no one talks about. And once you understand it, you'll never look at nighttime hydration the same way again. The deeper truth is this. After 60, many seniors don't have a pure water shortage. What they have is a delivery problem. Your body may contain fluid. You may have drunk your 8 glasses. The water is in there, somewhere. But without the right balance of sodium, potassium, and magnesium, that fluid doesn't stabilize nerve muscle firing the way your calf needs it to at 2 in the morning. Think of it this way. Imagine filling a car's radiator with distilled water. It's liquid. It's in the system. But it's missing the coolant, the compound that actually does the job. The engine overheats anyway. Your muscle works the same way. Water is the vehicle. Electrolytes are the function. Without both, you've got volume with no purpose. That's why a senior who drinks 8 glasses of plain water a day can still cramp at night. The water arrived, but it couldn't do what the muscle needed it to do. Because the minerals that make water useful to a muscle were already low, already being drained by medication, already not being replaced by the right foods. It is delivery. That's the word. Not dehydration. Delivery. The water got to your body. It didn't get to your muscle in the form your muscle could use. A 2004 report from the National Academies, now the National Academy of Medicine, established adequate intake levels for water, potassium, sodium, and chloride together. Not water alone. Together. Because the body doesn't use them separately. It uses them as a system. And when you break the system apart, when you push water without minerals or minerals without timing, the pieces don't add up. I'm telling you this because nobody else in this space will. Now let me show you where the risk compounds. Because it's not just one thing. It's the stack. A senior who takes a diuretic for blood pressure, that's one mineral drain. Add a proton pump inhibitor for acid reflux. That's a second drain on magnesium. Add a habit of drinking plain water late at night, instead of earlier in the day with mineral-rich meals. That's a third strike. Add sweating from a warm house or summer heat. Fourth. Add age-related decline in thirst sensation and kidney concentrating ability. Fifth. Now I need to pause here because this is important. If you're taking any of these medications, diuretics, laxatives, ACE inhibitors, ARBs, or potassium-sparing medications, the electrolyte picture becomes clinically significant. Do not adjust anything on your own. This is for educational purposes only. Always discuss changes with your own doctor. What I'm giving you today is the understanding. Your doctor gives you the plan. So what happens when the water gets in, but the muscle still can't use it? The nerve stays excitable. The muscle stays tense. And in the quiet stillness of 2 in the morning, when blood flow is slowest, when body temperature drops, when you've been lying still long enough for the calf to shorten, that excitability finds its moment. The cramp fires, and it holds. 9 minutes, on average, according to the American Family Physician Review. 9 minutes of pain that didn't have to happen. Most seniors never get this far. They manage one piece of the puzzle. They drink water. Or they try a magnesium tablet. But they miss the delivery mechanism, the balance, the timing, the medication interaction. And that gap is exactly what keeps the problem returning. So now you know the full picture. And this is where the conversation turns from what's going wrong to what you can actually do about it. First, notice the pattern. When do your cramps happen? Is it the same leg? The same time? Do they follow a day when you were outside in the heat? Do they come after you skipped meals? Do they show up on nights when you drank a lot of plain water right before bed? Or the night after a heavy laxative day? Start paying attention, because the pattern tells you where the imbalance lives. Second, stop thinking only in terms of more water. Start thinking in terms of balanced hydration. That means water, yes, but earlier in the day, paired with foods that bring minerals with them. A baked potato with the skin gives you over 500 milligrams of potassium and 43 milligrams of magnesium, according to USDA Food Data Central. A half cup of cooked spinach brings 78 milligrams of magnesium. A banana adds 32 milligrams of magnesium and over 400 milligrams of potassium. These aren't supplements. They're dinner. And they carry the minerals in a form your gut can absorb with the food itself. Think about what you do before bed. If you're chugging a tall glass of plain water at 10 o'clock at night, try this instead. Move your heavier fluid intake to the afternoon and early evening. With a meal. With food that has sodium, potassium, and magnesium built in. By the time you go to bed, Your body has had hours to distribute that fluid and those minerals, instead of minutes. Third, review your medications. Not on your own, with your doctor or your pharmacist. Bring a list. Ask one question. Are any of these affecting my magnesium, potassium, or sodium levels? A 2013 study published in BMC Emergency Medicine confirmed that existing diuretic treatment on admission to the emergency room was associated with an increased prevalence of electrolyte disorders. Your pharmacist can often flag these faster than anyone. Use them. Fourth, be cautious with electrolyte powders, potassium-heavy drinks, or magnesium supplements, especially if you have kidney disease, heart failure, or you're on blood pressure medication. These products aren't dangerous for everyone, but for some seniors, adding concentrated minerals without knowing your baseline levels is guessing at the exact point where guessing becomes unsafe. A conversation with your doctor takes 10 minutes. A mistake with potassium in someone with kidney trouble can take you to the emergency room. So to be clear, this is not about drinking less water. Water matters. But after 60, the question isn't just how much. It's what's in the water when you drink it, what else your body is losing, and whether the minerals that make water useful to a cramping muscle are actually present when the muscle needs them. Most seniors never connect this to that. Today you did. A 2017 study in PLOS 1 found that between 37 and 50% of older adults experience nocturnal leg cramps. That's nearly half. And the majority of them are managing it with the same incomplete advice. Drink water, stretch, wait it out. You now know more than that. You know it's not just water. It's delivery. It's timing. It's the minerals your medications may be draining. It's the thirst signal your brain stopped sending reliably years ago. The data from the National Institute on Aging is clear. Older adults are more vulnerable to dehydration not because they don't try, but because the systems that regulate fluid balance, thirst, kidney function, hormonal response, all weaken with age. And when you layer common medications on top of that natural decline, the margin for error disappears. This is not age. This is something your body is doing. And with the right understanding, the right foods, and the right conversation with your doctor, it can be managed. Not by guessing, by knowing. If this kind of straight answer is useful to you, and I believe it is, subscribe so you don't miss the next one. I cover the things most seniors are never clearly told, and that matters after 60. Before I let you go, there's one more thing. And this might be the most important part of everything I've said today. If your cramp pattern is new, if it's only on one side, if it's getting worse week after week, or if it started after a medication change or an obvious shift in how much fluid you're losing, do not write it off as just getting older. That pattern deserves a conversation with your doctor. Not next month. Soon. Night leg cramps after 60 are often about fluid balance, mineral balance, and timing together, not plain water alone. Now you know that. But now that you understand why plain water isn't the whole story, there's something else happening after 60 that can keep magnesium and potassium from doing their job in the muscle, even when you think you're eating right. The foods you trust may not be delivering what you expect, and the reason has nothing to do with the food itself. I cover exactly that in the next video. Watch it now.